The meaning and the severity of stage 3 colon cancer should be fully understood by the patient for two reasons. Number one, because this condition is not that bad, since 50% of patients are already cured by surgery alone without doing any chemotherapy. Second, because the benefit of preventive chemotherapy is extremely high. It increases the chances of cure by about 20%. This means that out of 100 patients with stage 3 colon cancer, 50 get chemotherapy unnecessarily because they are already cured by surgery alone. 30 will get it unnecessarily because they will fall back anyway, despite chemo. But 20 get chemotherapy with extremely great benefit because instead of falling back and going wrong, they will be cured by chemotherapy. Actually, the situation is not that simple. In fact, the chances of cure after surgery alone are not 50% for everybody with stage 3, but vary between 5–10% and 80–85%, depending on the size of the removed tumor and on how many local nodes are invaded by the tumor. Their combinations give the conditions shown in the graph. The first set of blue bars describes the chances of cure after surgery without any preventive therapy. The second set of red bars indicate the increases in the probability of cure thanks to one preventive drug, fluorouracil. And the third set of yellow bars report the additional benefit of chemotherapy with two drugs, FOLFOX or CAPOX. It is intuitive that the price to pay, that is the toxicity and inconveniences to suffer of the two different levels of therapies is very different. Getting only one drug is relatively simple and not very toxic. Getting two of them is more complex and more toxic. Under certain special conditions of very low risk within stage 3, it is possible that a patient may even decide not to get preventive chemotherapy, whereas in general, if the risk is high, two drugs are chosen by the vast majority of patients because of the huge benefit of this adjuvant preventive treatment. Thanks for following.